When a patient comes to you, he puts his eyes in your hands, and it's a big responsibility. It's just not a transaction. He has put his complete faith and trust in you, and you need to give your best. There are different types of patients, and there are some that are calm, some that are extremely anxious. So you need to learn about human nature and understand the patient, and then try to calm them and then assure them of the best. As a surgeon, there are no days that are off. You need to compartmentalize. There are many things happening in your life. There can be financial stress, problems at home, but all this you need to kind of put it out of your mind. You need to learn how to compartmentalize. And when you're in the operation theater, the only thing that you see is your patient and the eye. Medicine is not a profession, it is a calling. And this is something that you need to be very passionate about because it's a long career. You start off when you're young and you almost sacrifice your entire youth in studies. You need to sometimes study 16 hours a day. So there is no end to studying. So once you become a doctor, you're constantly studying. There is a saying, drudgery is the bane of medicine, because you're doing the same things day in and day out. That ability to help a patient to feel better, to see better, to give the best results. So it is a profession where you have to inculcate not only daily practice but also academics and teaching, and this is what keeps it alive and interesting. There is always a reason as to why someone takes up a profession. For me, it was something very personal. I saw my grandmother and my great-grandmother who were blinded after cataract surgery. In fact, my great-grandmother had her surgery in her house. The surgeon came and operated in her own bed. For me, I think more than me finding medicine, medicine found me. When I was a boy, I was quite playful. In fact, my mother was quite worried whether I would actually make a career. But then once I got into medicine, then I really became serious because I just enjoyed reading about the human body and how it functions, and I was very curious, and that's when I actually became very good academically. I think since then it's been a very fruitful journey. After I finished my MS with a gold medal, I couldn't land a good job. I was actually forced to start my practice. I started my practice in 1994, more than 30 years ago. I just started very small in a small room. But my whole aim was actually to give the best to my patients. I remember when I started my clinic, I used to work up till like 9 o'clock, 10 o'clock. I've operated on so many children, very small children. The youngest child I've operated was just 6 weeks old. Normally children, when they're brought in, they're not able to see. You know, the parents are very anxious. And then when you examine the child and tell them that, see, your child has cataract, they're shocked. You say, doctor, cataract, it comes only in adults. It's only after a particular age. My child is just 6 months old. But there's something known as congenital cataract. But what is, the best reward is after the surgery. Probably for the first time, the child looks at its mother and smiles. That is what this profession is about. It's about the joy of doing something, of giving back and enriching somebody's life. As a single doctor, you can only treat that many patients. But when you have a quality teaching program that teaches and trains other doctors in surgery, then you can cater to so many more people. When I started practice and the practice grew, I could not devote time for a lot of patients. And that's when I kind of realized that I need to bring in more people, train them in my way of assessing the patient and doing surgery. I had my first fellows way back in 1997, 98, when I remember a young doctor came and told me, I want to train with you. I don't want to go to any other institution. I've been observing your surgeries, but then I want you to train me hands-on. And that's when I started the training program. It was a very small, humble training program. And today we take about 6 fellows every 6 months for training. We have trained nearly about 300 long-term fellows and a lot of short-term fellows in quality cataract surgery and refractive surgery, so that they can go out into the world and then give this kind of quality service to more patients. Later on, in about 2000 or so, we became a private limited company, and that's when we actually became an institution. We had a lot more consultants, we had fellows, then we started our DNB program, which is residency in ophthalmology, then a postdoctoral fellowship in different specialties, and also our School of Optometry. We also started our charitable work in 2000 with the Shraddha Eye Care Trust, and today we have 2 eye hospitals, community not-for-profit eye hospitals, where we do almost about 10,000 free surgeries every year. We have done more than 1 lakh free surgeries up till now. So this is how we have built this ecosystem in ophthalmology, where we have quality teaching, training, the latest technologies, fellows who can come and learn, and also a lot of research work. Some of the cutting edge research, global trials have been done in Nethradhama. Medicine is indeed a noble profession, and it is how you look at it. Of course, today there are so many aspects, but it is a noble profession, and then you're doing something to help somebody live a better life. And I think if doctors keep that in mind, definitely I think patients also would kind of appreciate the work you're doing. So I wish you all a happy Doctors' Day.